Welcome, everyone. Welcome to tonight's episode of the Grapevine Wellness Show. This is episode 1 of season 2. I am so excited for tonight and I'm happy to be back in this space with you all. I'm your host, Jolyn Armstrong, founder of Grapevine Inner Wellness. As a certified trauma recovery coach and grief recovery specialist, I provide coaching for people who struggle with anxiety, depression, grief, trauma, and PTSD. If you or someone you know is suffering with any of these things, or if you're interested in living a more intentional, fulfilling life and aren't sure what's holding you back, please do reach out. I'm offering those attending live this episode a complimentary session with me to determine if coaching is right for you. So don't hesitate. You can email me at connect@grapevineinnerwellness.com or call 916-415-8619 to schedule your session. But let's get to tonight's topic. Let me ask you, does back pain ever keep you from doing the things that you enjoy? Does it ever impact your work, your sleep, your emotional well-being? If so, you are not alone. Approximately 65 million individuals in the US have experienced back pain recently, and about 16 million adults suffer from continuous or chronic back pain that restricts them in various daily tasks. Back pain ranks as the 6th most expensive health issue in the United States. It's no joke. If you have back pain, even if you've seen a chiropractor or other kind of pain specialist, you'll want to listen to this entire interview. You're going to learn how you can end back pain without surgery, how you can look and feel better, how you can improve your overall health, how you can increase your ability to stay active at any age. My guest tonight is Dr. Daniel Welch. He's the owner of Northern Nevada Chiropractic, and his mission is to help people live happier, healthier, pain-free lives. I love that. If you have any questions during our interview, you're welcome to pop them in the Q&A box below, and I'll be sure to address as many as possible at the end of the show. So, Dr. Welch, welcome to the show, and thank you so much for being here.
I really appreciate you asking me. It's a pleasure to be here.
Definitely. Fantastic. Well, I am excited to pick your brain, get all the information that we can from you this evening. But I wanted to back up a little bit and start with getting to know you as a person a little bit better. I just wanted to ask you what motivated you to get involved in chiropractic in the beginning. Can you help us out?
I had no idea what chiropractic was until high school. I've told a number of my patients this, but my mom had a personal story where she had lost her voice for almost 2 years, and she was almost to the point where she was whispering. And she was a travel agent, so it definitely affected her job. And she was doing high-dose steroids, and they were going to do exploratory surgery. And she got to the point where my father said, "Why don't you just try my chiropractor? What do you have to lose?" So after 2 visits, her voice was like at least 80 to 90% better. And I thought this was witchcraft. I had no idea what happened. And apparently her laryngeal nerve was getting pinched, just a mild thing that went undiagnosed. And I just thought it was pretty interesting that a conservative therapy like that made such a difference. So I looked into it, and it was just one of those careers that the more I looked into it, there was some hesitancy because it wasn't as mainstream, but I really enjoyed the non-surgical, non-drug approach, self-empower patients like I always try to do. And I've been very blessed with this career for the last 18 years.
Wow. Yeah, I would never have thought of going to chiropractic for a problem with the voice before. That is really very interesting. And now that you explain what it was, yeah, that makes sense.
Yeah, we see a lot of non-traditional back pain issues, but that was one of the unique ones for me. So
Yeah, for sure. Well, I think in the couple of times that we've talked, Dr. Welch, leading up to tonight, I really get the sense from you and your entire staff that this is really fulfilling work for you, that it's not, you're just going to the office 9 to 5 kind of job. But I want to talk a little bit about what gives you the most satisfaction in your job. What is this doing for you, and what does it mean to you?
I view it like I have an opportunity to change people's lives, and I know there's
Mhm.
many ways you can do that in different occupations, but I love the crawl into the office and they walk out. They don't happen every day, but it's very rewarding when you can make that kind of a change within a 20-minute session.
Yeah.
Um, I like the conversations. We have most people have the same people they see every day, and I love my coworkers, but I also get 30 unique conversations between patients every day. So it's a very rewarding experience.
Yeah, yeah, I love that. Well, that doesn't surprise me knowing you a little bit that is the kind of the draw and the aspect for you
Yeah,
for sure. Yeah. Yeah. Well, let's get into it. How about that? Let's talk about some back pain.
sounds great.
Some
Yeah,
back
can't
pain
wait.
stuff. Yeah. So let's talk first about the causes of back pain, what you see when people come in with this pain. What's been going on with them?
Sure. I think most people associate my job as a chiropractor as neck and low back pain. And I would say that is definitely the meat and potatoes of what comes in my office. I personally got into specializing more in disc related issues. They, I felt like it's kind of archaic when I got into this that the majority of my patients were told the first thing that they can do when they have that is rest and do nothing. And then if that doesn't work, go to injections. Maybe they did PT. And if that doesn't work, surgery. And for the last 10 years at least, we've been doing decompression to help unload the discs on patients that have had the sciaticas and the pain down the leg and the chronic back pain patients. Um, it works in different ways, but the main thing we're trying to do is just create a better environment for the body so that you can get back to the motion that you're wanting to do.
Mm,
So no matter what therapy we're going to do, we have 20 different ways to work on a patient. The main objective is get them functional again so that they can get back on the path of rehab, because any of these passive modalities, if they're relying on us for it, it's just going to be a temporary fix until they can get over the hump. And it's nice being able to work with other providers in that regard. If I have a really hot patient that can barely walk, then maybe an epidural or pain meds are needed just to get them to that point. But that's
mm.
never going to fix the problem. They don't have a shortage of cortisone in the body. That is not what's causing the problem. It's just getting them into a position that they can get to the relief they're needing.
Yeah, yeah, to come in and do the work.
Mhm.
Yeah. So are you seeing people in your practice? You're operating here in Reno.
Mhm.
Are you seeing people who are um, have had a sudden injury? Are you seeing people who have over time like just gotten worse and worse to the point they can't take it anymore? What do you see more
I
of?
guess we see the full gambit. I would say the average
Mhm.
patient has always tried self-medicating with the Advils. Everyone does that, and I
Yeah.
get it. It's easy, it's cheap, it makes sense. Not great on their body, but I get it. Um, Most people have tried the more traditional stuff first. They're going to their family doc, and maybe they got some muscle relaxers for back sprain that they did. I wish I could say it's always some athletic thing they did. The majority of my patients got out of bed the wrong way, and now they can't turn their head. It's welcome to 40, but that's just how it
Uh-huh.
goes sometimes. um, they were told they have arthritis. Arthritis is a factor, but it's usually one of many things.
Got it.
I see an X-ray on a patient and they have this new hot low back pain, and I just take an X-ray with extensive arthritis. It's obviously had been there a while, so that was not the cause of the pain. It's just precipitating, creating a worse environment for them over time to get to this point where the pressure's on the nerve.
I see. I see.
So
Yeah. Yeah.
I think that gets overdiagnosed, and I don't know a lot of patients at a certain age that don't have some amount of wear and tear. And when people hear that term arthritis, that's all. There's 100 different kinds of arthritis. There's rheumatoid, there's fibromyalgia, there's osteoarthritis is kind of what we focus on mostly. Really, it just means wear and tear. It's like a callus in your hands from rubbing your hands together. It's just friction.
Gotcha. Oh, okay. So arthritis isn't like a this awful
Mhm.
sentence that I've been handed that I'm going to wind up in bed
Right.
the rest of my life.
Yeah. I mean,
Yeah.
most arthritis is just not one thing that caused it. Yeah, maybe they fell 20 years ago out of a tree when they were a kid and it precipitated this, but most of it is 1,000 days at a desk job sitting forward, head posture, rounded shoulders. That's what's causing the rubbing and the irritation. And the Western diet didn't help with their inflammatory cycle. And it's just one of many things leading to this situation.
Gotcha. As you say that, I feel myself. Okay, no, I'm gonna sit up
I do the
straight.
same thing. Don't worry.
Yes, as a person who spends a lot of time in front of a computer. Okay. So yeah, all that's just fascinating to me. Let's talk about, when a person is spending their time in pain, these negative kind of health effects of back pain that, some of them I can imagine, but I imagine there's some things that I haven't even thought about that back pain can cause.
Yeah, I mean, even when I was in school, they would always tell you rest and relax and lay down. And
Yeah.
maybe for the first day, I would agree with that. But all the new research says get and move. Get up.
Mm.
Take the fire down initially, but you got to move. If you don't get moving, you're never going to heal right. You get these adhesions built up on patients. Even if I'm doing my job, most of the time I'm telling patients I'm not taking the pain away. I'm creating a better environment for your body to heal itself. It's
Wow.
if we're really being honest, majority of my patients, we're speeding up this process. They're eventually going to get out of pain. We just want to make sure they heal right. If they're healing in this position, they're going to build up adhesions and scar tissue, and then they wonder 20 years down the road where this came from, all this bone spurs and scary stuff they see on their MRI report.
Yeah. Yeah. And I mean, I've always thought about that too. Grandma would throw her back out and she'd be in bed for days and days and days,
Yeah,
and maybe even longer, right? And then when she'd get up, she'd be really careful, yeah,
yeah.
about that, and
Mm-hmm.
move kind of gingerly. And I can imagine if that goes on, that kind of pain goes on for a time, even those like altered way of moving
Mm-hmm.
can cause those issues for
Well, it's a
sure.
vicious cycle because you
Yeah.
want to immobilize that area initially, and it feels good because you're not hurting yourself, and
Yeah.
then you just get less and less active. So it just precipitates to the next event that now you have atrophied muscles the next time you hurt yourself, and you're in a worse position to heal the next injury.
Yeah. Yeah, and I love that the research is showing what feels good to me is getting up and moving sooner. And I think
Mm-hmm.
we've seen this in um, with back pain and just surgery recovery,
Oh
recovery
yeah,
from childbirth, and the whole, like all of it, right? It's get up and get going.
yeah,
And because, the next question I have for you is about like the mental and emotional effects of
absolutely.
having back pain, right? And
It's very isolating. Yeah, I know the
yeah.
first time I had a real shock in the face, like I was like 29 years old when I think I was just having a long day and I just bent the wrong way and my back went out. And
Mm.
it was a humbling experience because you treat people all day and you just like, okay, yeah, you have back pain, I get it. Like, let's fix you up. And once you actually experience, like, oh, I see what you're going through. Like I have to consider how I'm getting in and out of my car. I can't just get in and out of the car. And it's isolating in that you're not going to go out and visit your friends or your family as much. And if you
Yeah.
have chronic back pain, it's very isolating. I mean, this is probably they go hand
Mhm.
in hand with the mental and the physical side with chronic back pain and depression. So
Right, for sure. And then there's the fear, especially with back pain. It seems like the fear is, oh my gosh, this is my future. My
mm-hmm.
life now has changed, right? And I mean, it might be
Very good
different
point.
with,
Yeah.
yeah, a sudden onset injury, like I've been hurt and maybe I can get past this, but especially with that kind of, oh, my back's been hurting for a while and my activity level is just
Mm-hmm.
slowly declining. Um, and then fear sets in, and then resignation sets in. Like, I'm
I would
just
say
this.
across the board, the patients that I see in my office that I'm most worried about are the ones that initially get hurt. They're probably a little frail because they're not as active. It's hard to get in shape when you're in your 80s. It's easier to stay in shape, when you're in your 60s and work your way up there. And it's the balance. Once you lose your balance and you haven't been training that at all, the fear avoidance. You don't even want to go outside when there's a possibility of ice.
Yeah.
It's terrifying because the statistics show you fracture a hip, your chances of making it 5 years are diminished significantly. So,
Right. Right. So there is that, yeah, that worry that, okay, I'm already ginger on my feet, right?
yeah.
Being careful. And yeah. So, um, do you see as many mental and emotional impacts on younger people that come in with back pain, either from an injury or a chronic thing? Or is it more impactful in the like an older generation? I don't know.
That's a good question. I would
Mm.
say when I just anecdotally, when I'm thinking of patients that are having some issues, the most of my younger patients that have had chronic pain, usually it's a byproduct of some other co-lingering disease. They have diabetes or they have some autoimmune issue as well that they've already
Mhm.
been dealing with that is predisposing to this. Um, the mental and emotional side of it, I think they don't know any better and they're so used to this. They've just kind of resigned themselves that, well, this is my life and I've only known this. So I think that people my age, like in their 40s, when they're now just starting to like feel what the everyday aches feel like now, and they're not just popping up at 20 after a long night and they can wake up the next day without sleep and be fine. It's more that shock, like, oh, this is it. This is what everyone keeps talking about.
Yeah.
Um, but I like to believe most of my younger patients have developed enough good social networks still that they have people to talk to. I know
Yeah.
that doesn't go across the board, but a lot of my older patients, I, I I have a feeling that they don't have a lot of that to go around. So, I'm by no means a counselor, but I'm a voice that they can talk to, and it's an isolating world out there if you don't have someone to talk to about pain and that can relate to what's going on.
Yeah, for sure. And yeah, I felt that from you right from the start, Dr. Welch, that you real that care that you take with your patients and that ability to talk with them is just it's really, yeah, it's impressive. It's a good thing.
I appreciate
And
that. Thank you very much. Yeah.
yeah, yeah, the feeling in your entire office is that way. So yeah, it's but you're right. The isolating aspect of um any kind of pain, I think, is a big deal. So
Mhm.
all right, well,
The
let's talk. Oh, go
Go
ahead.
ahead. Yeah. No,
I
I was
was
just
gonna
going to say with some of these issues, it's not just the pain. Like I see it in the physical side of things a lot more peripheral neuropathies and that kind of stuff as well. And when
Mhm.
patients don't have that feeling in their feet, they might not be in pain every day, but they're like not going to walk with their grandkids as much now. And that's also the isolating factor in it too, where they can't do the stuff they want, not because of pain limiting them, but they don't trust their body. They can't get up and move like they used to.
Yeah. Yeah, no, that's a really, really good point. And especially that lack of feeling in the extremities. Oh my gosh, yeah, I can see that for sure. I have the desire to go out and do things. I want to. I just don't trust myself to not be injured, be hurt
Right.
worse.
Yeah.
Yeah, that's hard. I can imagine. Let's talk about how to prevent, how to avoid injuring our back in the first place. Um, and then maybe we can lead into how to avoid
Sure.
making an existing injury worse.
I love everyone to be proactive and
Yeah.
do exercises and stretches even when they're not in pain. But let's be honest, pain is a very good motivator. That's usually what gets them in my office in the first place. Uh, I, I've heard this question. We talked earlier, like, oh, once you go to the chiropractor, do you have to go for the rest of your life? My answer to that is always, do you go to the dentist for the rest of your life? It's if you're going preventatively, it's maybe even if just a couple times a year on some of my patients that are good about staying on top of things. It's just not letting things accumulate. It's that silent killer of you lose 5 degrees of range of motion, you lose 10% of your strength, you're losing a little bit of balance. And those little factors that probably wouldn't affect your life become big factors down the road. So the major prevention thing I would tell most of my patients is you give yourself 5 minutes a day to brush your teeth morning and night. You need to do something for your body. I kind of wish we were almost see through, because I think seeing grime in your teeth is going to make you be careful about oral hygiene. But nobody cares
Yeah.
about your spinal hygiene. Like unless you have a really bad kyphotic curvature and you're hunched over, most people don't even, they're not going to know they have a bone spur starting to form, or rubbing in the joint spaces, or loss of disc height. That's the tricky part with this stuff, is usually it's already there by the time you've made inventory of it.
Yeah.
My things I tell all my patients about is you need to be really conscious of eating right first off. I mean,
Hmm.
I'm not going to tell you have to have a specific diet. Everyone's got specific needs, but if you're fueling the fire with more inflammatory food, nothing we do on our side is going to matter. You got to feed the engine with the correct fuel.
Yeah.
So for most of my patients, it's avoiding nightshades, it's avoiding a lot of processed food, sugars, the very basic stuff. It doesn't mean you have to go a complete 180, but you got to be cognizant of it. You got to hydrate with more water. It's the basics. But most people, you know, they're considering that after the fact. They just want to pop the pain medication first. That's the first thing before you even see me. Go do that. And then I would always recommend you find a stretching routine, because as strong as you want to be, you always want to mobilize before you stabilize. If you are very immobile and you haven't worked out in years and you try to go do a new gym workout, you're going to do it for a week or two, and then you're going to be so miserable because you're so sore, you're never going to stick with it. So get the joints moving properly, lubricated, get the range of motion back. It's going to be so much more easy for you to get back in some kind of weight bearing exercise routine.
Gotcha. I love that holistic approach, caring for the body in some realistic ways to avoid that, to avoid injury. I love it. Love it so much. Even though I really do prefer my white cake with buttercream
Yeah,
frosting,
I
it
know,
sounds
right?
like you're telling me no. Maybe
I'm a
dial it back
hypocrite
a
sometimes
little.
too. I love cookies, but I try not to eat them every day.
There you go. There you go. Okay. All right. I think we can come to an agreement on that.
Yeah.
Yeah. Okay. So then let's talk about if we have injured ourselves, especially those of us who do, like, go from stillness to, oh, I'm going to work out, right?
Yeah. The weekend warriors. Yeah.
Yeah. Yeah. Let's talk about not making an existing injury worse.
The major thing I'm seeing is repetitive motion injuries.
Yeah.
In tendons especially. So you got to remember the anatomy, where you have the muscle doing the work. The tendon is what connects the muscle to the bone. We're seeing a lot of tendinosis, which is just rubbing and inflammation of the tendon. Tendons don't really inflame, but they're overused. And because of that, that heals much slower than muscle. So
Mm.
you injure your muscle at the gym and you work out, that's not necessarily a bad thing, but it's a day or two. There's a lot of blood flow to the muscle. It's going to heal much quicker. Tendon, if you roll your ankle, like you sprain it, that's more of a ligament. But if you really injure the tendon going up Mount Rose for the first time in the last 10 years, that's going to take weeks. So you just got to be patient to some of this stuff, where
Mhm.
you got to give yourself some grace. It didn't take you 40 years to get out of shape. It's not going to take you 2 days to get in shape. Okay. I
Right.
would always start most of my patients on some kind of either isometric exercise routine, where they're just holding a position against gravity. Think of like a plank. I don't really like planks for some patients, so I don't want to say blanket everyone should do planks, but it's not going to hurt you because you're not putting it through a painful range of motion.
Gotcha.
Um, that kind of exercise and pretty much any tendon is a safe bet to start with, unless you have a total rupture, which, that's a whole different beast. But the big thing I would tell almost everybody is don't guess, go get whatever provider you're going to see and get it diagnosed.
Yeah.
Imaging's cheap. You can see what's going on inside your body. Then you have a clear pathway on how to treat something.
I love that. I love that. So getting in and being seen early as soon as possible so you know what you're dealing with. and then going from
Yeah.
there.
I have a lot of patients that haven't had any imaging in 10 years and they are still getting treated. And that sometimes scares me because
Mm.
playing Russian roulette with your body.
Yeah. 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 I get that. Wow. Okay. That's love it. Okay, so let's talk about steps we can take to, those of us who have some back pain, varying degrees of back pain, what we can do to still stay active, what we should avoid doing, what we should do,
Mhm.
just to, yeah, if the idea is let's stay as active as possible for as long as possible, let's do
Yeah.
it safely. Yeah.
Just find out what your goals are. A
Hmm.
lot of my patients, maybe they're wanting to ride their bike or play with their grandkids. It just, you got to find what's your passion, what fills your soul, because you're not going to stick with anything if it's not really what you care about. So
Right.
a lot of times I'll just ask my patients, what is success for you? What is win for you going to be? If it's just getting out of pain, that's easy, but staying out of pain is the tricky part. It's
Yeah.
what are you going to do to maintain that? And if you're doing an exercise routine you don't like, you're going to do it for a couple of weeks and you're going to give it up. So me personally, I'm a runner. I know that's not the greatest once you get to a certain age, so I have to do stuff to stay on top of that. I don't like working out, but I work out so I can run. It works for me.
Gotcha.
For most of my patients, I would just say start with the basics. Give yourself 5 to 10 minutes a day of going for a walk with your loved one. That's an easy thing. It forces you guys to have a conversation and it's just putting you in a good mood. So hopefully that's
Yeah.
an easy start with most of my patients. Um, don't ignore your hips and your knees.
Mm.
Almost most of my back pain is whatever's hitting the ground first. If they're really bad feet and they're pronating a lot, it could just be you need a small insert. There's 100 different ways to treat this, but you got to look at what's hitting the ground first. Um, kind of all over the place with this one. So
No,
I
I
see a
mean,
lot of people wearing back braces that come in for the first week or two tops of after an injury. Great, just to immobilize and give that joint a chance to heal. But kind of
mhm,
like what I was saying before, you do that and you become reliant on that crutch long enough. I see a lot of the guys at Home Depot wearing that every day when they go to work.
yeah.
That's a recipe for disaster too. So there's a happy medium where do what's healthy, but don't become reliant on these external devices of some sort to help.
Yeah. Well, I think that kind of loops back to seeing an expert early on, see what actually is rather than learning from, I don't know where those guys learn to wear those back braces all the time, but
Yeah.
actually, getting good quality professional information,
Hmm.
um, not waiting until you have an injury, right, to get in
Yeah.
there for some education and some advice there.
And to kind of go back, I hear a lot of times, oh, I know I need to lose weight. And I have plenty of skinny patients that have terrible backs. That like being
Hmm.
overweight does not equate to back pain. So
Yeah.
obviously you want to have a healthy weight, but one of the first things I look at when I look at an MRI is, yeah, I'll look at the report, but the reports never tell me how does the muscle look around it. I've never had someone get hurt from being too strong. Typically, it's usually the other way around. So I, I could care less if you're a 65-year-old grandma. If we can give you some really basic strengthening exercises, no one's going to get worse from doing that. So
Yeah.
I'm a big fan, and I will push this guy's stuff because I push in the office all day. It's called foundation training. It's just a basic yoga routine you can find right on YouTube. If you type in those two words, foundation training, he puts the stuff up for free. And it's one of the safest things you can do to just start isolating those lower back muscles that have basically been fatigued for the last 10, 20 years.
Hmm. Great foundation training.
Mm-hmm.
That's what you said. Yeah.
That's what I said. Yeah.
Fantastic. I'll be looking that up too.
Yeah.
So, all right, that is great. So, let's move into how kind of how you help people with back pain when if I'm hurting and I come into your office, what can I expect?
Number one thing, like I keep reiterating, is leave with a diagnosis or a
Mhm.
path to a diagnosis. If I can't figure it out that day, we're going to find a way or find the right provider for you that hopefully can point you in the right direction. My big thing is we're trying to be non-invasive. There's no drugs, there's no surgery. It's most of the time, worst case scenario, going to be sore for a day or two. I mean, every case is a little different depending on their issues, but it's pretty conservative uh, occupation, which I love. There's really never downtime with what we do, so you're not going to be out of work for weeks after we're worth you. Um, the main thing we're trying to do is get you back to a point where you're moving correctly. And if that's just maybe doing an ergonomic consult because you are so bad positioned at work, or it's changing what you're putting in your body, it could be as simple as
Yeah.
that. So everyone's different on what they need. So I don't believe in cookie cutter care plans. So
There you
some
go.
people need 3 times a week for a couple of weeks. Some people need one visit and they're good. So
Gotcha. Okay. So if I come into you because I'm aging, I don't have a ton of back pain yet, but I'm worried about it just because of whatever lifestyle,
mhm.
maybe sedentary in front of the computer. Would you suggest a person like me who, is in this stage, but not necessarily hurting yet? Would I benefit from a consult just to see if there are some changes that I could make with my unique um, kind of lifestyle?
Well, first off, I would say no if you look this good at 80, but assuming that you're really 80, everyone would benefit with some kind of preventative care. I don't
Yeah, yeah.
really push it hard, but I view it that just getting checked every once in a while makes it so
Hmm.
much easier to diagnose these things before they become a problem. I subscribe to that myself. I get adjusted probably every 6 to 8 weeks just because of what I do for a living. It's a physical job. Um, if you're really not having issues pain wise, it actually makes my job easier because we're not really trying to take you out of pain. We're just trying to make you more functional, like I said. So
Yeah,
we are trying to work on fall prevention on my 80-year-olds. We are trying to work on balance issues, proprioception. It just depends on what their specific needs and wants are. But
yeah.
if we're not having to get past that acute phase where they're already, hot and bent over and can barely walk from one room to the other, we've just saved 2 weeks of care. So
Yeah, yeah, well, that's good. And gosh, maybe longer if they don't come in right away, right? So,
and it's
yeah.
it's a team approach, like I was telling you before. It's we do not fix everything. I had one guy come in with total foot drop where he was just dragging his foot, and MRI
Mm,
showed really bad disc. He is past my point. I wish I would have saw him earlier, but there is an absolute
yeah,
need for some patients to see a surgeon, and I'm never going to bash them because they do a skilled thing. It's just I feel like it's shouldn't be the first thing on the algorithm of care. So
sure.
same thing. I'm a big fan of physical therapy. I think everyone would benefit in doing some kind of routine and having someone monitor how they're moving and how to do some of these exercises. I definitely go over that with my patients, but I also refer out for that so they can spend a whole hour with the patient. Massage therapy goes hand in hand with what we do, and the mental health approach, like you were talking about. And
Mhm.
I don't know anyone that doesn't have chronic back pain that doesn't have mental health issues as well with it. So I would love to have more resources so that it's a full encompassing approach in how to treat these people.
Yeah, yeah, for sure. We talked a little bit about that, but you're right. It is the effects of any pain on mental health is immense, actually. And I don't know, there's something about back pain that seems to be even more scary for a lot of us, right? It's just like, oh no, what am I gonna
Well,
hear
yeah,
horror
and that's the
stories?
other thing I get a lot of times is, they associate chiropractic with just popping, twisting, and all the scary stuff. And I would say the last 3 or 4 patients I had tonight, no one even got adjusted.
Hmm.
They're either on some table, they're learning a new rehab exercise. One of my patients, I don't think I've mentioned it before. We have a shockwave machine. It sounds scary, but all it is like an acoustic wave that helps to break up adhesions for like someone with a frozen shoulder or plantar fascia. Works really well for those connective tissue issues.
Oh,
So I like to believe that we're more than just moving joints around from left to right. That we do some interesting stuff with fun toys.
Yeah, I want to hear more about that. So let's talk about some more of those kind of the latest advances, things that
Mhm,
you are able to do. I know most of our conversation's been about back pain, but let's talk
mhm.
about things that you're able to help folks with and the tools that are
I
out
love
there.
the sports med back approach. That's what I was trained in. So I see a lot of sports related injuries. So, you know, treat a lot of baseball players, for example. And I don't know any baseball player that doesn't have a rotator cuff issue. And that doesn't just follow the baseball. That's everyone when we get a certain age can't raise their arm over their shoulder. So that's where we use the cold laser. We have two kinds of laser. One's stronger than the other. They both have benefits and side effects. The whole idea behind it, it's like a magnet for blood. It helps to stimulate blood flow to an area that's been chronically hurt, so it's losing blood flow to it. Um, when we need to break up tissue more, we've been recently incorporated that shockwave machine. It sounds scary, but all it really is it feels like someone's like hitting you with a rubber band a little bit. It's like a little knocking sensation, and it just helps stimulate um, it actually can help with stem cell reproduction, but it
Oh,
really is effective with, yet again, bringing blood flow to an area that's been chronically atrophied or degenerated. Helps to break up even bone spurs on some patients. So,
wow. Oh, that's fantastic.
yeah. And then we have the time tested stuff like the electric stim. We use that as a nice way after they get adjusted to relax the muscles and keep them from slipping right back out after what we just did on them. That's been around for 100 years and still works. So we keep using it. And then
Gotcha.
the big thing that we do is for treating discs specifically is the spinal decompression tables. We use it for the neck and the lower back. Um, the main idea behind that is just constantly pumping. The fancy term for that is imbibation. Think of like a sponge filling with water and then releasing. Discs, have a little disc here.
Oh,
The space between the joints, they don't have direct blood supply. So the only way they get nutrients in and out is through every time you take a step, for example, you're squeezing, releasing. That's what allows nutrients to come in and out of it. Most of the time, people hear the term slip disc, and that's a colloquial term to mean the inner part of the disc is leaked back and is pushing on
wow.
that exiting nerve root now. So when people say, "Oh, I have a sciatica," it's just either most of the time one of the lowest lumbar discs is pushed back on the nerve and causing pain. For me, that's a physical problem. So we like to incorporate a physical fix, which is unloading. So usually within a few visits, we're trying to create that traction effect, that decompression effect to take the pressure off the disc, create a negative pressure. And that's what makes a big change in getting that hydration back in the disc and honestly restoring some of that disc height that we've lost.
Gotcha. Okay. Wow,
Yeah.
fantastic.
Doesn't happen overnight though. So like I was saying, very
Mm.
low blood flow to it, if none. So it takes a few visits when you have a documented disc to get that fixed. So, you know, a sprained neck is a couple visits usually, whereas a bulged disc that's causing sciatica, that's weeks to maybe a couple months of care, fairly regularly to make a difference, but still much better than surgery if you ask me.
Oh, well, yeah. It sounds like it. It sounds like it. So you're able to manipulate a disc that's pushing back into place, but then there's more work to be done after that. Did I hear that right?
Yeah, so the
Yeah.
main goal is taking the pressure off the nerve. That's the whole idea with the table. And, you can go on my website and see all this stuff. We have all the videos and all that, but it's
Yeah.
basically a giant harness type system that's the inner disc pressure is getting decreased to
Mm,
resorb that material back to where it came from.
gotcha.
Um, and then with that, obviously, if you have someone that's got arthritic joints and stenosis, which is like a fancy term for narrowing, that timetable is going to take longer,
Mm,
but that doesn't preclude you from getting worked on. And
mhm.
then once you get them in a good environment where they have that pressure off the nerve, that's when I feel the more important work happens where they do the strengthening and the rehab to keep out of pain. You can throw a bunch of drugs at it and you'd probably be pain free, but you can't really function that way. So,
Yeah. Yeah. Right. Right. Okay. Well, and I love that, anything natural without pain medications. I think, I don't know, I'm always attracted to that because of that effect that pain meds have on our lives, right?
Right.
So
Yeah,
necessary when they're necessary, fantastic. But if we can avoid them, let's do that.
absolutely. Yeah. Yeah. Yeah.
Yeah. Yeah. So, and I also love that you have videos on your website. So a person who's a little hesitant to come in can see what some of the things that you do before they
Absolutely. Yeah.
visit.
It should not be a surprise when you come in our office of what's happening.
Yeah.
We like to be as upfront and honest of what we do here and the YouTube page and all that stuff, but it's most of what's going on is just you're getting a diagnosis. From there, if you're a good candidate for what we can offer, there's probably a small treatment plan of a couple weeks if needed, depending on your issue. And the nice thing I think about our job is it doesn't usually take weeks and weeks and weeks to see if you're going in the right direction. I mean, I'm not going to promise every patient they're going to be better in a visit or two, but you'll probably be different. It doesn't usually take chiropractic a ton of time if it's going to help to make a difference.
Oh, that's really good to know. That's really, really good to know. Yeah. Yeah, I know my son doesn't live here in Reno, but he's a mechanic and leaning over cars all the time. And he's like, "Mom, I don't know what happened. My back just started hurting." And I went to a chiropractor and oh my gosh, it's so much better. Like I still had a couple of days where I was recovering, but yeah, he was super happy. As a young man, he's
Yeah,
completely sold. He's like, "I love it. I love it so much."
it's a
So
rewarding job. Yeah, it's pretty cool
yeah.
what we do. But I hope
Yeah.
he's doing the proper steps now though, so that the next time he's not going to have the same issues. Proper
Yeah.
technique, which is tough to do. I always say some of my worst patients, at least in Reno, are my car dealers, my dental hygienists, my hairdressers. I mean, you're just 10 hours in this position over and over and over. So,
Yeah. Yeah. I have a feeling as much as my son appreciated the manipulation that he had, I'm not sure that he got. I asked him like, "Are you gonna? What do you do differently now?" And he wasn't sure. So, from the person in the state that he's in, I'm not sure that he got the education that you
yeah,
provide your patients. It sounds like. Um, but next time he comes to visit, we'll probably be to
I
see
think
you.
your job as a doctor should primarily be as an educator. It's
Yeah.
the
Yeah.
patient's not getting anything more than just the treatment. And I feel like I failed. I was
Mm,
telling you before, if I don't want a patient that comes in once a week for the rest of their lives. That means I'm probably not doing them the full service. They're not reliant on themselves to take care of themselves.
yeah. Yeah, I agree. I agree. And yeah, I could like I've mentioned maybe a couple times now that I really have sensed that from you and why we invited you onto this show is because you're so interested in that education piece and that just it shows a level of care for your
Mhm.
patients and I definitely appreciate that for sure.
Thank
So,
you very much. Appreciate that.
yeah, yeah. So, have we covered the the kind of the latest advancements, the tools that you can use and those is there anything that we haven't addressed?
Um, there's multiple. I mean,
I
I
know,
wish I could
yeah.
cover everything, right? But
Yeah.
a lot of the times we have different providers here that have different skill sets. Um, Me and Dr. Riley, for example, got trained in dry needling, which is, I won't
Mm,
say it's acupuncture. I don't want to offend any acupuncturists, but it's similar in that regard that it helps to reduce pain without doing anything more than just throwing some small needles in. It's very non-invasive for the most part. Um, we do for like chronic adhesions, we do more of that muscle scraping. I don't know if people have seen those YouTube videos of people getting like the metal bar on them. It sounds horrific, but it just depends on each case. Like you'll leave with a little bit of reddening in the skin, but it's not that bad.
mhm.
Um, I my personal take is I just like rehab. I just
Yeah,
find that fascinating. So that's kind of my approach. But I just think surround yourself with different people. I refer out to doctors that specialize in pediatrics or in
mhm.
geriatrics. And it just depends on what, got to have that network of people that you can
Sure.
rely on.
I love that. Yeah, I love that. I do like that. It's part of that holistic approach, right?
Mhm.
I just especially love a doctor who will say, listen, this is not going to be that bad.
Yeah.
No, but I get it. There are things that are super beneficial that sound kind of scary and maybe leave a red mark,
Oh
but
yeah.
yeah.
Yeah,
I
a
got
lot of
you.
times we're just talking people off the ledge, that they think
Yeah.
this is the end of all the things because they have this 10 set term they saw in a diagnosis, and it just means slippage, or it just means,
Yeah.
wear and tear, so
Yeah.
that's being the counselor to them, I guess, is in that regard, or a voice to lean on. So
Yeah, yeah, having someone like you with that medical background who can let us know in real terms, like this, this is actually what this big old word means. That sounds
yeah,
so scary. It's going to be okay. So,
yeah.
yeah,
And we always do that. I mean, a list with
yeah,
our MRI patients, because a lot of times, I hate to say it, but they don't understand what they were told, and maybe
yeah,
they haven't gone over them. We always do that as a free consult. We just do MRI consults if they need it.
for sure. Yeah.
Mhm,
Oh, that's really good. That's
mhm.
good. All right. So we're getting close to the end of our time together.
Okay.
We do have a couple of questions. And then I want to talk specifically about your practice and what you've got going on there. So there's one question. I'm not going to use the person's name because it looks like there's maybe some personal information in here. I'm just going to read what they wrote. Okay. So I've suffered pain and physical restriction in my S1 joints, and I've had 3 types of injections, 2 types of ablations. Been to PT and a chiropractor. I was seeing what looks like a local provider, and he said he showed you my X-rays. No surgery would help. What can I do?
Hmm.
Yeah. So you've
Well,
seen some X-rays from yeah.
yes. Obviously, I'd have to see who I'm talking to on this regard.
Yeah.
I'm assuming S1, he meant SI joint,
Oh,
because
maybe
that's the
SI
sacroiliac
joint.
joint.
Maybe. Yeah.
Yeah. It just depends on if he's not a candidate for surgery. It really depends on if we're talking management or fix. A lot of times I'll even see someone with a fusion. You're probably not going to ever get that patient better, but you can make them feel better. That they're never going to be doing backflips again, probably, but we can get them to a point of reduced pain. Um, one of my favorite things to do is the flexion distraction table when I have someone like that. It's just a very passive modality that bends and rotates without putting a lot of pressure on patients, just to get lubrication back in the joints that do move. Because
Mm,
you're dealing with someone, it sounds like, that had 3 levels of degeneration, and those levels are just not functioning correctly. So the levels above are going to have to compensate. Unfortunately, those are going to go down, and that's the progressive nature of these injuries, is that when one goes, the one above it has to do the work, which is going to be the next
mm,
to go in line.
yeah.
So I don't want to speak out of turn because I don't know exactly what's going on with that patient, but I would love to take a look at the imaging again. So
Yeah, yeah. It sounds like maybe that person might benefit from coming in for a conversation.
yeah, and I wish I could fix everyone that comes in.
Yeah,
Maybe it's out of my scope. I don't know. I'd have to take a
yeah.
look.
Okay.
Mhm.
All right. So I hope that answered your question. You're welcome to put another question or follow up in chat if
Mhm.
you're yeah, if you'd like some more information. And another person said, what about neuropathy? I mean, that might have been when we were talking about some specific things, but can we speak to that?
Yeah, peripheral neuropathy, that's very abundant. I see that everywhere.
Mm,
Most people associate that with some kind of lower back issue. It could be diabetes. There's many different kinds of peripheral neuropathy. It's just a way to say the nerve is not functioning correctly. Peripheral meaning not spinal, something distal in the extremities. Okay. Um, Yet again, we manage, we don't fix. No one's got the magic bullet. Stem cell aren't 100% there yet with that kind of stuff. We have been seeing some benefits with the laser and especially the shockwave to help stimulate cell proliferation. I would never say it's going to fix anyone that comes in, but it's a good option. Um, Peripheral neuropathy can benefit with some of the drugs. I know everyone starts usually with gabapentin. That's more of a nerve relaxant. I wouldn't say it helped manage it, but it's most people that have already seen me have tried it and it doesn't work. maybe I'm seeing a biased opinion because I'm only seeing the ones that fail.
Uh,
Um,
yeah.
if it's coming from a stenosis in the spine, it's a little bit trickier because you got something choking it off way far away from where the actual symptoms are. I see it mostly in the feet, so I would usually start people off with the laser because it's very non-invasive. You would do probably a handful of sessions. If that didn't make a difference, we would jump them to like the shockwave machine, which penetrates a little deeper.
Gotcha. Gotcha. Okay. Fantastic. Thank you for that question, Rosie. Zandra says, what are your thoughts on places like The Joint, pay a membership fee and go all month long?
I, I've actually employed someone from the Joint. I would never batch another chiropractic office. It's just a different philosophy. I think it works really good for wellness care, and that they even say it in their title that they're meant just for more that preventative nature, where it's a nicer, cheaper option. And I, you know, I personally would want to spend a little bit more time with my new patients, but everyone's got their what they need. If you just want a quick tune up, great, good option.
I love that. I love the integrity and thank you for that response. And thanks for the questions, Andra. Jason asks, what can chiropractic do for grade 2? Oh my goodness, I'm gonna try this word. Spondil
Spondylolisthesis.
Thank you.
Yeah.
L4, L5.
So that's that fancy term to mean slippage. It usually means
Okay.
that more than 25% of if it's 4 or 5, more than 25% of 4 is in front of 5. So it's slipped forward. Most of the time it's genetic. It's not even something the patient did. There's some degenerative forms too, but a lot of times I see it in the younger patients. They did not win the genetic lottery.
Mm,
What we do with those patients, you can still, depending on what their issue is, having a spondy, which is the colloquial term for it, doesn't always cause pain. I see it a lot on patients when I'm taking an imaging and they didn't even know they had it because it's not an area where they're in pain. The ones that are painful, it's usually because there's compression in the nerve. It's that funneling effect from one bone slightly in front of the other. You already are dealing maybe with something hypermobile. So the first thing I would do before anyone would want to get treated is do something called stress views and make sure there's no instability. So if they had a slippage of that vertebrae and it was stable when they bent forward and bent back, then I'm safe to treat them. If they weren't, they're not a candidate for our care. But
mm.
decompression works really well for those patients. We do a lot of core stability type exercises, a lot of intrinsic muscle exercises to really help create a better environment so the spine doesn't move any more than it already has.
Gotcha. Okay. I am
That was a wordy
sure.
answer, sorry.
No, that's great. And I think that speaks to that education piece and what you are so fantastic at
Thank
with your
you.
patients. Yeah. I've got another question from Jason. Spondy, now I know the term,
Yeah.
caused by fracture in vertebrae somewhere along the line.
Okay. Well, I would assume because of this, he probably had a burst fracture. I don't want to assume anything, but
Yeah.
that would definitely change things. You would want to get a CT scan to see how stable the bone was first. If it was just slippage from an old chronic injury and the bone integrity looks good and there's no osteopenia or osteoporosis, it's still manageable. It's still something that we could look to treat. You wouldn't want to gamble with someone that had poor bone mass, slippage, and instability at the same time. That would be the pros wouldn't outweigh the cons in treating in that case. So I don't want to say anything too much from a medical standpoint until I would say what other parameters are there.
So it sounds like with something like this, a fear that some people might have would be, I've got this issue, I've got this diagnosis, and I can only imagine with a word like that it comes with a fair amount of pain and a worrying prognosis.
Mm-hmm.
My worry might be if I go into a chiropractor to see if they can help, they're going to try something on me, whether they should be or not. And so I'm
Yeah,
worried about
it's a
coming
very valid
in.
concern. Yeah.
Yeah. So it sounds like not the approach that you would take because you are a more like you have that appreciation for a global
We've all,
approach.
with good intentions, adjusted someone or did a therapy or did something that was too aggressive. You learn from your mistakes, I guess is my honest answer. And that, I know for sure, there was a patient, for example, a few years ago that, I wanted to help get her out of pain, and I put her on a table that was just passively bending, and she kind of got stuck because her muscles got spasmed from getting too
Oh,
relaxed too quick. So you learn from those mistakes. So
mhm.
I totally get that. I still think the pros and cons is there, and that it's still a very conservative therapy. You might be a little sore, but I'm not going to over medicate you, or something like that.
Yeah. Yeah. Well, and it sounds like with your integrity, you would take a look at, the imaging and, everything that's going on and be able to say, okay, yes, I would suggest this or this, or, you know what, I'm going to refer you
Sure.
on
Yeah.
to a,
I mean,
yeah,
you see what the contraindications are, and
yeah,
that's, I wish I could say, do an investigation on the doctor, but that's why we try to be upfront about what we do here, and that,
yeah.
we like to believe you're not walking in blindly. You can kind of
Mhm.
see what you're walking into.
Sure.
That's how we like to do it here.
Sure. Okay. Well, Dr. Welch, thank you so much for coming tonight and for being so open and giving us so much of your time. I
No
feel
problem.
yeah, really really grateful and blessed to have you here. Let's talk about your business, where you're at, what is the best way for folks to get in touch with you and to get scheduled with you.
Um, we're here in South Reno, Nevada, off of Longley Lane. It's called Northern Nevada Chiropractic. That's our website too. If you just put a .com at the end, there's a few of us. There's two other docs and one part-time doc that works with us. So it's kind of we can collaborate a lot of times if there's a complicated case. I have a few CAs. We specialize in disc injuries. That's kind of our specialty here. Been doing it for, I think, close to 18 years now, and very passionate about what we do.
Fantastic. Fantastic. Do you have a phone number in your head that you can
Oh, sure,
share?
yeah. It's 775-829-8686. Yeah, it's most people go through the website, but that's how we find us.
Great, great. So website's a great place to go and schedule and the whole bit.
Yep.
Beautiful. Dr. Welch, thank you so much for coming. I appreciate
I
you.
really appreciate you asking me on, and I'm looking forward to working more with you down the road. So.
Awesome. Okay. All right. Thanks everyone for coming. We appreciate you too. All right. Good night.